The ongoing pandemic has changed the way that we think about many aspects of life, including mental health and health more generally. Scientists and clinicians alike have been looking for clues about identifying individuals who are particularly at risk for mental health consequences with the ongoing stress of the pandemic. Much research has been done on clinical predictors, but he and colleagues report important new results that looks at measures of brain function as predictors of emotional problems in the wake of the pandemic. The new findings are important because they derive from a relatively large study in a group of individuals who have been followed over time. And the new data suggests that both biological measures and clinical measures provide important information. And they suggest to clinicians that by further developments in research on biological correlates, we may be able to find new measures that help us predict outcome, not only to the stress of events such as the pandemic, but stressful events that we might see in later years. For many years, we've known that alcohol use disorders develop slowly. And there's been great interest in using some of the initial signs of alcohol use disorders to predict which individuals are most at risk for progression. King and colleagues extend research on using alcohol challenge tests. And what these tests do is they expose individuals to alcohol by having them drink it in the laboratory, and they measure the acute effects of alcohol. The important observation from King is that these acute effects, when individuals are followed over time, can predict which individuals are at risk for an alcohol use disorder. And what the findings teach us is that individuals who experience extreme rewarding effects from early exposures to alcohol might be most at risk. And this should encourage clinicians to pay attention to their young patients' response to alcohol, because among people who find it extremely rewarding, we should pay attention to risk for later problems.